In your health headlines, cancer cases are on the rise in younger adults.
While the median age for cancer diagnoses is 66, early onset cancer is up in patients under 50, many without typical risk factors. A local cancer survivor shared her story with me about the power of prevention and persistence.
Hey, Amy, good morning.
Good morning.
People will tell you that if it hurts, it's not cancer, but that was not true in my case.
Amy Kalal is a two-time cancer survivor. In 2006, she noticed a spot in her mouth. A few months later, she brought it up to her dentist, who thought it was just gum disease, as she didn't have the typical risk factors like age, smoking, or drinking.
It started to get bigger and painful.
After 2 dental checkups over a year's time, she was referred to a specialist.
I was sent then to an oral surgeon, and she said, "This is not cancer."
A biopsy said otherwise. Kalal then turned to Dr. Deepak Kadamani.
She has a typical story that we see with many of our patients where she saw multiple practitioners, she knew that something was wrong, but there was a significant amount of time where she had a delay in diagnosis.
Dr. Kadamani was able to remove the cancerous part of Kalal's jawbone when it was still at an early stage. Her advocacy led to a better outcome than many. Head and neck cancers are diagnosed in late stages 50% of the time. Because of that, Dr. Kadamani established the Head and Neck Cancer Foundation in 2020. The foundation is providing free screenings across the state this month.
We only have about 60% of the U.S. population that regularly sees the dentist. So for people that don't have access to care or don't have frequent dental exams, this would be a great way to get screened.
69% of adults are behind on at least one routine cancer screening, according to a survey by the Prevent Cancer Foundation. Health providers across Minnesota are working to spread awareness of early detection and make various screenings accessible to everyone. Along with the Head and Neck Cancer Foundation screenings, Allina Health is now scheduling for free skin cancer screenings for Melanoma Monday on May 6th. mHealth Fairview provides free colonoscopies for uninsured or underinsured Minnesotans. And the SAGE program by the Minnesota Department of Health provides free breast and cervical cancer screening to eligible women. Kalal says the key to surviving is taking action early and often.
You know your body and what is not normal for you, and so advocating is really important. Catching this early saved my life, 100%.
One of the top reasons for being behind on cancer screenings, people simply didn't know they needed to be screened. It shows the need for more education and awareness. The Head and Neck Cancer Foundation is hosting its 3rd annual Run Walk at Lake Bede-Makaska on Sunday, May 19th.
Yeah, it's so relatable, and I feel like we hear more and more of these stories. Of course, we do because we work in news, but I knew something was wrong. Doctor said I'm fine. I got a second opinion, a third opinion, fourth opinion if you're still not feeling well.
Yeah. It sometimes takes a while, and as you heard Amy say, you know your body best. The doctor can only do so much with the information they're given. One of the other things they're obviously trying to do is make sure more dentists get the training so they might be able to catch these things a little more often when they're at that precancerous stage.
Yeah, and especially concerning because we have a lot of stories, just the rates are higher among younger people for no particular reason, or we're still pinpointing and learning, and so...
Those numbers of how many people don't regularly go to the dentist, also think about how many people don't see a primary care physician every year. I'm among them. Haven't been to the primary care doctor in about 2 years.
Well, you better schedule
that. Need to get it, yep.